Can you all hear me?
Yes, I can hear you.
Okay. We'll just wait for another 1 to 2 minutes and then we'll start so that maximum number of people join and then we'll start our session. Hello everyone, I'm Dr. Iffat. I'm your mentor for PLAB and OET sessions. I welcome you all to today's session and I hope most of you have joined by now. This was a free webinar, so we wanted that a lot of you could just get facilitated and get benefit from this particular webinar that we have organized for all of you. So I think we should start now. It's already, yeah, it's 9, so let's begin. So I hope you all are doing well. I hope you all are excited for today's webinar. It's going to be a good session. It's going to be a very basic session, actually, just to let you all know what the PLAB exam is, right? It's an introduction to the PLAB examination. And in this particular lecture or in this particular webinar, I'm just going to give you all an overview about this examination. I'll make you get through the different aspects of this particular examination and what you can do, how you can plan your sessions, how you can basically, prepare yourself for this particular exam. All right. I know all of you have joined us from various places. So if anybody could just, let me know where they're from, how many of you are from Pakistan, how many of you are from outside Pakistan, that'd be great. So you can write it in the chat box, or if anybody wants to introduce themselves there, they can do that. And then we'll officially start our webinar.
Well, thank you very much, Dr. Iffat, for holding this session. That's very nice, actually. So this is Omid. I'm originally from UAE, actually. So my father comes from there, but I'm resident in the UK. So I'm preparing for the PLAB, actually, but recently I have been very busy. So thanks to Ariba, there was a colleague called Ariba. She's messaging, actually, and talking about, let's say, the preparation, the courses available. Thank you for holding today's session. Thank you.
Thank you so much for joining us. I hope this session proves to be of great help for all of you. And I'm so glad that a lot of people have joined from Afghanistan, from India, from Malaysia. So there's a lot of people from Azerbaijan. So lots of places from all over the world. So it's great to have you all. And let's begin then. All right. So what do you guys know about the PLAB exam? I know you all would be, you would all know that this is a licensing exam to, get qualified with the GMC, to get registered with the GMC. But has anybody ever, given this exam or gone through the entire drill of preparing and giving and unfortunately not being able to clear? Does anybody has any of that experience? What they felt like, what was lacking, what they think, or what aspects they want to, they realized after the exam that should have been improved in the preparation part, or things that made them want to join this session, or they're thinking of getting a preparatory course. Anybody with any experience, or you all newbies? It's okay if you're comfortable, you can share it. Otherwise, I have a lot of cases because we've been doing this for a long time now. And there've been lots of cases where people have, they've tried preparing, there's this very common concept and notion that you just do the plavables and you're good to go. There'd be lots of very, there are two different poles apart things that some people say that, we've just given a month or so and then we've cleared this exam, where there are other people who have sit for this exam for the past 6 months, they're preparing and they're unable to clear it. So the reason is that in both the cases, the thing is smart studying and studying in the right direction. Because, we all are from the healthcare setting. We've all been through very difficult and draining exams. And at the end of the day, we cannot, retain each and everything in our brains. So an exam is always there to assess a few things because it's like a short exam. The examiner would be only assessing a few knowledge-based stuff. So you need to know as students or as people who have to sit for the exam, what aspects are they trying to assess you for, and then you have to prepare in that particular direction. So a lot of people end up scoring well because they are well oriented. They know how to, in what direction they have to put their efforts in, and that is why even in a month they can see the results. But then there are other people who give a year or 6 months to this thing and they're unable to clear it because they prepare in a direction that's not very well guided. All right. So the entire purpose of developing a preparatory course for all of you out there is that, we would help you and we will facilitate you in preparing in the right direction. We have had a very successful OET batch. We have some very successful OET batches in the previous years. And, the only reason why we have had 100% result is that we've helped them understand the various tips and tricks to get through the exam. Similarly, our sessions in this particular in this thing, it would be specifically designed to help you practice the questions, because previously what we were doing was that we were giving out lectures in our live sessions for the PLAB exam. But we all know that a 2-hour lecture is not very effective as compared to solving questions, doing past papers, taking a module, doing as much questions as you can, and understanding the reason behind the correct answers. So this time what we have done is we've revamped the entire thing, and we are now going to introduce we're just going to provide you with the recorded lectures, and in our live sessions we're going to discuss the MCQs, the EMQs, the questions which we would get from various resources. We're going to get from them. So basically that's what we're going to, that is what our sessions are going to be about. So I just thought that I'd give you a brief overview of what we'd be offering you all. So we'll be doing practice sessions per module, and we're going to practice as much questions we can with obviously explanations. And we're going to chalk out the entire plan for all of you. So anybody who would like to get more details for it, I think Ariba has shared the link and the number, so you can ask her for more further details. All right. So let's start with our today's webinar. Now, as you all know, that the PLAB exam is just, it's a licensing exam. It stands for Professional and Linguistic Assessment Board. If you want to work in the States, you have to sit for the USMLE exam. If you have to work in Australia, they have their own particular exams. In Middle East, they have their own exams. Saudi Arabia has its own SLEs. Dubai has its own DOH, MOH, etc. So if you want to work in the UK, the exam that's been accepted and the exam that is basically that you have to sit for if you want to get a foundation training or the ST training over there is basically PLAB exam. Now, previously there was this thing that, PLAB was the only thing, but now in 2024, GMC announced that they would replace it with UKMLA, right? But till date, this has not been implemented. The only difference between the two is the name, okay? There is no other difference between the two exams. So just clear this thing out. PLAB and UKMLA are the same thing. It's just that they've just changed the name because the pattern is the same, the assessment is the same, the two parts are also the same. The first part, like PLAB 1, UKMLA also has a first part. And then there's a second part. The first part is AKT, I think, and the second one is clinical skill something. So it's the same thing, which is like equivalent to your PLAB 1 and PLAB 2. Till date, there hasn't been any any implementation. The people who have registered so far, who have sit for the exam, they're just giving PLAB exam right now. But since GMC has said that we are going to implement it, so this is something that is in general and it's going to get implemented. And they would obviously, if you've booked an exam and they want to introduce UKMLA, so they will let you know with the notification that okay, you guys will be sitting for UKMLA. But there's nothing to get panicked. You guys are not supposed to get panicked or not get it's not a big deal. The exam is the same, the assessment, the examination criteria, everything is the same, because medicine all over is the same thing, right? They have certain modules, they will get questions from that. It's just you need to understand and work in the right direction and use your knowledge as well as your understanding of the stuff. Okay, so whenever you're solving a question, always remember to go into detail about what or how an answer is, and how basically what the explanation to an answer is. If you will work on your concepts, then obviously whichever exam is in front of you, whether it's PLAB or UKMLA, things would become more easier for you and it'll make more sense to you. So this is one thing that you need to clear, that till now it's not implemented, but they've said this thing that in case we want to implement it, we will let you know. The people who have booked the exam, we'll give them a notification or an email, and we'll let them know that now we're going to implement UKMLA. So you guys have to be prepared for it, right? So this is something that's not implemented yet. So till now we discuss obviously PLAB. The things are same. Like I said, it's just the name is different. Otherwise everything is the same. All right. Then, like I said, these exams, obviously every board has their own particular prerequisites that a person needs to fall in this criteria in order to qualify for working in a particular setting. For instance, if somebody wants to work in Pakistan, you have to get registered with our medical council, which is PMDC, and you have to sit for our exam. And they would basically assess your basic knowledge whether we are suitable for working in a Pakistani environment. Anybody who wants to sit in a Saudi environment, want to practice over there, obviously they're going to the particular board will assess them. Similarly, if you want to work in the UK, then PLAB is the GMC is the governing body, and they would basically assess you through PLAB if you're not going through the specialty training pathway. If you're going from the basic pathway, then PLAB is the best thing to sit for. All right. Now, like I was saying that, let me just give you a brief overview about this exam. So there are two parts to PLAB exam, as you all know, and I think most of you would know by now. One part is your PLAB 1, which would be for which this whole preparatory course is designed. And the second part is obviously PLAB 2. PLAB 2 is your clinical assessment exam where you have to perform or you are being assessed. Or you can call it in other terms an OSCE exam, where your clinical skills are being assessed, your ethical behavior, your professionalism, your history taking sessions, all of them are being basically assessed in your PLAB 2. Whereas in your PLAB 1, your knowledge and your ability to comprehend a question, understand what knowledge you have, how you are applying your knowledge, and how you're basically, what sort of learning you have, how your basics are, that is basically being assessed in your PLAB 1. So it's an MCQ, or you can call it an extended, matching question or multiple choice question sort of a test, which is computer based. So all the centers that are offering PLAB 1, they will definitely offer the computer based test, right? The areas that they focus on are they do ask a few questions from the basic sciences, but mostly the whole bulk of questions are coming from your clinical sciences, right? So there's the big difference between a USMLE and PLAB, that in USMLE they work from the basics to the clinics, right? But in PLAB things are a little bit easy, and a few chunk is there from your basic sciences, but most of the questions are coming from your clinical sciences, right? So that's why it's very much advisable that after your foundation training in your whatever respectable country you're from, you sit for this exam, because your things are really fresh. The things that you study in your final year, then your foundation training, or house job, whatever you call it in your country, um, it's very much fresh, so you can basically sail through this exam. But even if you're not practicing, then with a little bit of hard work and efforts, and you'll be able to sail through this exam as well. So the focus areas are, like I said, they are clinical medicine, like surgery, gynae, pediatrics, questions coming from emergency medicine, etc. So all the clinical subjects, followed by patient safety, ethical and legal and bioethics module is very important in this. And other than that, different questions related to medical procedures, the commonly known ones, right? And the second thing that you need to know is that are you even eligible to sit for this exam or not? Because obviously, to be eligible for a particular exam, you need to fulfill a few requirements. All right. The basic thing is that you need to have a medical degree, the primary medical qualification that's recognized by GMC. So you go to GMC's website, and when you're making your account, you put in your institute from where you got your primary medical qualification, and you need to see whether GMC recognizes that institute or not. All right, so this thing is important. Secondly, once you've done that, you book your OET or IELTS, whichever exam you want to take, English exam, you sit for that exam, right? Because this is the most important thing. This is the most important step for taking PLAB 1, because without an IELTS and OET score, you're not eligible to sit for this exam. So in case anybody has not cleared their IELTS or OET, or if they've sit and not gotten the desired score, then it's very much important that they first clear the OET and IELTS exam, and then they go on for booking the PLAB exam. Clear? The minimum requirement, obviously you have to go to the GMC website and see what the requirement is, but for IELTS, I think they need an overall band of 7 or 7.5, whereas in OET they need an overall grade B in all 4 subtests. All right, individually all 4 subtests, the minimum requirement is B, and overall also the minimum grade should be B. All right, so you need to get the desired scored. Once you've done that, then you can obviously book your PLAB exam. All right, and These are the two basic requirements for eligibility. Other than that, there's no other prerequisite for sitting for this exam. All right. Now, if we talk about the PLAB format, so it's 180 multiple choice questions, all right, and you have 3 hours to complete this exam. So I think 3 hours are well and good for a 180 long multiple choice question long exam. And the major chunk is coming from your clinical medicine. Like I said, your ped surgery, gynae medicine, your emergency medicine, your ophthalmology, your EI, ENT. Um, your major chunk is coming from the clinical medicine side, and what they're focusing on in those subjects are how you're picking up a diagnosis. All right, are you making the correct diagnosis or not? What treatment or management you're offering, what investigations you're offering, and what other common medical conditions or complications such diseases are causing, right? So this is the basic thing that they're trying to assess, which is the most basic uh, you know assessment. And you can all recall that back in your medical school as well, your final year exams were designed in this manner, that they would assess whether you can make the right diagnosis with a few presentations that were given in front of you, with a few symptoms that were given in front of you. Then once you've made the correct diagnosis, how you're managing and treating the patient with the investigations that you're offering, and with what different warning signs are there, what complications that a patient can of such case can develop. So this is the thing that they're basically trying to assess, right? And the other 20% of the questions are your bioethics, or you can say medical legal questions, where basically they want to also obviously assess whether a person has the knowledge to work in the UK, because you are going to work in the UK as a doctor, right? You're not going to work in your own home country as a doctor. When you're working in your own home country, you know what the ethics, what the ethical dilemmas are there of that particular region, what medical legal requirements are there. You study forensic in your medical school just to know how things or legislations or rules, regulations regarding medicine work in your own country. So same goes for the country where you're applying, that if you want to work in the UK, you need to be aware of what ethical norms they have, what are their ethical dilemmas, what are the medical legal things that you need to know about or be cautious about. So all the bioethical part is making up 20% of this exam. That means it has a very big weightage. So you have to also not, you don't have to take this part, less seriously. Rather, you have to work a lot on this part, because this part will significantly make a difference. The other part, 80% of the questions, everybody gets it right because it's just a knowledge assessment part. But these 20% make the difference, which help you in either clearing this exam or failing this exam. Because we as people working in our own home country, we're not well aware of their norms and their ethical problems or their legislation. So retaining that information and implementing it at the right place and proving that is basically difficult. So you have to focus on this 20% of the questions, and you have to work hard for them. Now, the key areas that are covered in your PLAB exam, like I said, are medicine. In medicine, cardiology, respiratory, infectious diseases, and neurology. These are very significant portions, right? Cardiology makes a very important chunk along with the respiratory module, because obviously, all the ECGs, all the, you can say all the heart failures, the management, the diagnosis of such conditions, all the congenital defects, everything related to cardiology is very, very important, because when you sit for the exam, you'll understand that how most of the questions are coming from such modules. Similarly, it goes the similar thing goes for respiratory as well. That you'll see lots of cases about acidosis, alkalosis. Then there'll be lots of cases about pneumonias and the what you can say, the coal workers lungs, such cases which are basically occupational health related lung problems. So lots of cases come from that setting as well. Then when we look at the infectious disease part, so the infectious disease component is again very important. All your travelers diarrhea and all your epidemics and all the contagious diseases, they're all basically the chicken pox from pediatric aspect, chicken pox, measles, these things are basically very important infectious disease part. And then in neurology, obviously the nerve lesions. at what segment they are basically involved. Well, those questions are very common, right? Then when the second is obviously surgery. In surgery, obviously there is trauma related questions, a lot of trauma related questions, how you manage a trauma patient in the emergency, GI problems, tumors, carcinomas, IBD, and ulcerative colitis, endocrine disorders, hyperthyroidism, a very favorite topic. In orthopedics, how you're managing the fractures in children, fractures in adults. So their management, treatment, the sort of investigations you're offering, all the question will be basically revolving around such themes. All right. Then in pediatrics, obviously, childhood immunizations have a very important role. The EPI schedules are very important, followed by various childhood diseases, the Kawasaki syndrome, the syndromes that mimic, that are overlapping, the syndromes that are congenital. Then hepatitis is very important in pediatrics. Along with that, the neonatal jaundice and all the jaundices, the newborn jaundices, the breast milk jaundice, all of them, they're very overlapping questions, and you have to be very, very, careful when you're answering them, because the diagnosis, more or less all 4 or 5 options look similar to you. So you have to be very careful, and you have to have a good retention and application of knowledge in order to understand what is the correct answer, right? Then obviously we have obs and gynae. So in obs and gynae, antenatal care, postnatal care, complications, family planning, contraception, very common topics. In psychiatry, schizophrenia, bipolar disorders, the fluoxetines, the SSRIs, the drugs that you're giving, the psychiatric emergencies, all of those things, suicide, counseling regarding that. Questions revolving around ethics plus psych are a very good combination, and they're very common. And in ethics and law, lots of questions about consent, informed consent, confidentiality, how to maintain that, then medical negligence, certain ethical problems of that country. So all of those things are very common in ethics and law, right? Now, the next question would obviously be that what's, because the content is too much, right? If you go on restarting from your medicine to ethics and law, you'll be lost if you read and cover each and every word or each and every book. So past papers and, study materials make a very significant difference, and they help you streamline your preparation. The most common resource, obviously everybody would know about that, is Plabable, right? But some people are saying now that Plabable is basically, they have a new pool now, and they're trying to the questions are not always, exactly, the questions will never be exactly like Plabable. Always remember this is a very big myth, that people think that, if they're practicing for Plabable, it means that the exam would be exactly a copy paste thing from Plabable. No, it's not like that. It's just that the Plabable questions are similar, or they are designed in the same way, or they're more or less like the original exam. So they have a similarity with the original exam, but it's not like that they're copy pasted, or the people who develop the Plabable exam, they're taking the content from Plabable. It's not like that. It's just that the material, the preparation, the questions that are designed, the themes, the things, they're very much similar to your original content, original exam, right? So Plabable is a very genuine resource, and you should all get the subscription for it. It's not at all very expensive. You have I think a 3-month subscription and a 6-month subscription, and also I think a yearly subscription. So if you plan to give your exam within 3 months, then 3-month subscription is more than enough, right? The second important resource is the Plabable gems are also there, that you can subscribe to, which are basically notes of the entire thing. Then you have med revisions as well, right? So these are a few resources that you can subscribe to, but I would suggest that do not subscribe to a lot of these resources, because obviously too many of resources can also confuse you. Just stick to 1 or 2 resources, right? And keeping in view how much time you have, obviously, and just stick to those resources. Try to do as many questions as you can from these resources. If you, for instance, if you score a wrong answer, then do look up and study that entire topic from a book. In case of books, your Oxford handbooks, if you recall back in your med school, you would have a very small, compact green color or Oxford handbook, right? So that handbook is very important. You can always open it up and look at your look at the explanation or study that topic over by yourself. All right. Then there's also one more important book called PLAB 1, The Ultimate Guide by Dr. Rajesh Nair. So if it's readily available, then you can also buy this one. Otherwise, maybe online it can be available as well. All right. And then practice exams are important. You should at least, whatever timetable you've developed, make sure that you have at least 3-4 days prior to your exam day. Your preparation is done, and then the next after you're done with the preparation, the next 3-4 days should be given to mock exam. So please do prepare for the mock exam. The PLAB also offers a mock exam. I think we are also offering a mock exam. So mock exams also very important. They give you an idea. They show you a reflection about how much or how well you're prepared. All right. So that's important. Do sit for lots of mock exam, even if you're not, if even if you're not attending a preparatory course, but then just do give a mock exam, whichever is available online. Just subscribe to it and give your mock exam. All right. Till now, the fees is another important thing. So till now, the fees is approximately around £250. All right. And you can book the exam through GMC's online portal. It's basically the GMC announces the seats. All right. So till now, I think the seats till August 2025 have been announced. All right. But what happens is that in case you have not booked your exam, what happens is that in between as well, sometimes GMC suddenly announces seats, because obviously everybody doesn't appear on the exam day. Some people just book the seat and they're unable to prepare in that time, so they just leave the seat. And some people, they also exchange seat. They let the other people take the seat and they take them out. And this thing is very common. So when you're going to sit for this exam, or when you're basically going to book this exam, so it's important that you keep a check, or you basically get what you can do is that what I did was you in on Facebook there are lots of PLAB preparatory groups, right? So it's advisable to join all those groups. The more you're going to join, the more better you're going to get idea about when GMC is going to announce the dates, or all the details regarding implementation of UKMLA or anything would be there in those groups, because a lot of people are discussing things, even they're discussing questions over there. So lots of things get revised, lots of things get lots of new material is basically also shared over there, so you can basically get used to, and you can help yourself get used to all those content as well. So make sure you join those groups. Any group you can take, you can join it, because over there you would get an idea that okay, when is the GMC going to introduce new seats. So obviously when they'll introduce new seats, you're going to quickly go on the website and you're going to quickly book your exam, because it's not like that, especially in Pakistan I'm talking about. I don't know about the other parts of the world, but in Pakistan getting a seat is the most difficult thing, because our seats in like a minute, the all of the seats get booked and you don't get a seat. So it's a very, very, very big issue over here. So within half an hour, seats get booked, and if you just delay if you don't join at the right time, you're not going to get the seat. That's for sure. So it's important that depending upon what the scenarios in your respective country is, you basically quickly go to the site and you just book your seat. If all the other checklists are, if your all prerequisites are, checked, you just book the seat there and then. And these groups will give you an idea when GMC is going to announce new seat in the middle of the year. All right. GMC's official website is, I'll show you after this session, I'll show it to you. But I think it is gmc.com, something of that sort. All right. Then exam centers, like I said, exam centers are available in various locations. In Pakistan, there's an exam center in Karachi, Lahore, Islamabad, all the big cities. In UAE as well, you'll find exam centers in Dubai. There are lots of exam centers in Dubai. People from Pakistan also go to Dubai and they sit for this exam in Sharjah, in Abu Dhabi. They're in India as well. UK is obviously, in all the big cities you'll find a center over there. All right, so exam centers are widely common, and you can obviously book your nearest exam center. Yes, in Russia as well, I think you have centers everywhere in all over the world. But obviously, you can go to the GMC when you'll be booking the whatever place your the nearest center that's near you. They give you the option, so you book that. In case lots of people are not applying in the country, in your country, then it's a very smooth process, and you can automatically book the nearest center. But in places like Pakistan, India, Afghanistan, I think, where people are applying in great numbers, it's very difficult to get it's very difficult to get the seat in your particular or nearest center. All right. Now, let's talk about what you're supposed to do on the exam day. So, the exam day is the most crucial day, all right? And the exam day is the most trickiest day. Obviously, you're anxious as well. You want to get done with it also, all the 3 months or 4 months or how many months you've gone through for this preparation, etc. You just wanted to get over it, and you want to sit for it. And also you're a bit nervous as well because you don't know what sort of exam would it be, and it's a very it's a very, very difficult situation for the person who's going to sit for the exam. There are lots of, you can say, um the butterflies in the stomach as well, and there are lots of hopes, and lots of good, you want to get done with it also, and you're also a little bit scared. But the more you're going to work on your nerves, the more you're going to keep yourself calm, the better you're going to perform on your exam day. So always remember to have a good night's sleep before your exam, because pulling up all-nighters before your exam is a very bad option. So it's better that you have a good night's sleep, right? Once you're done with it, wake up fresh, get yourself dressed up, go to the exam center with all the required documents. Make sure you have all the required documents. In case you don't have it, then you will not be able to sit for the exam. So it's a very important thing that you always keep the documents, the things in the email. They'll also tell you what stuff you have to bring along, but yourself as well, the night before the exam, make sure that the things that are required, you take them with you. All right. So arrive at least 30 minutes before the scheduled time on your exam day. Usually a valid passport and your photo ID is required, and the confirmation letter for you that would tell that okay, this particular person has to give this exam and in the center. So that's important. Water bottle is allowed, the clear water bottle, right? Not the ones, not the flasks, or not the the fancy water bottle, the tumbler cups. No, not like that. Only the clear plastic water bottle that's allowed, right? In personal items, you leave the personal items. You're not supposed to take the personal items in the exam center. So there's a designated area. You leave your stuff over there, and electronic devices like your mobile phones, your smartwatches, they're not allowed. All right. So make sure you don't bring them with you on the exam day. Bags, notes, etc. They're not allowed in the exam. Clear? And the pass marks is something that varies, because obviously it's like there's no set number of questions that you have to get right in order to pass through this exam. Obviously, it depends upon the the cumulative result, the aggregate that they make, and obviously the um on that day how many people scored a particular question right. So if a lot of people score the question right, then obviously it's a correct question. If a few of them score well, so they have this own examination and the assessment thing, right? So there's no set number, but obviously you have to try scoring the maximum number of marks so that you are able to pass this. Results are usually released 4 to 6 weeks after the exam date, and when your results are given to you, then the score is also reported. They tell you how many marks you scored, and they give you of your performance, that how much did you score in this area, which area you basically perform less in, etc. Okay. Now, now imagine you've all passed through the PLAB 1. The PLAB 1 drill is over. So the next step is obviously you have to book your PLAB 2. Booking PLAB 2 is easy comparative to PLAB 1, right? The PLAB 1 exams booking is difficult, but if you've cleared PLAB 1, then PLAB 2 is very easy. It's a simple OSCE exam, which assesses your practical skill. And in this case, in PLAB 2, you have to go to UK, obviously, to give this exam in Manchester. And a lot of people, what they do is that they take a few academies in that respectable, in that, nearby areas. There are certain academies that have been formulated, Samson's, and then one or two more. Is there a question? No?
I don't
All
think
right.
so, actually. You can go on.
Okay. So, for PLAB 2, you have to, you need to have a study partner. For PLAB 1 as well, or it's study partner, having a study partner is good because you can all obviously help each other in understanding questions and preparing and keeping yourself well directed and keeping yourself in a particular timetable, right? If you're used to having study partner, if you like studying, with friends, or combined studying is a thing for you. But if you're not comfortable with that, then obviously you can work on your own pace. But for PLAB 2, it's advisable to always have a study partner because obviously it's a practical exam, so it would be better. Yeah, please turn off your microphone so that the voice doesn't echo back. Okay. So, in that case, a study partner is very important, all right? And some people, they get registered to academies in order to work on their PLAB 2 skills, but others don't. So it's advisable to get registered to academies because they give you an idea about what sort of questions will be coming, because implementing your skills in an environment that's very new to you is something different, right? You don't know what the examiners are assessing. The exams are mostly assessing how you would work in an English healthcare setting. So that's something new to all of us. And it's important that anybody who has had a prior experience, anybody who's been through this and he's helping you get through this as well, it's important to then get through those academies and get a few trainings done to understand how PLAB 2 was about, right? And one thing, once you've cleared your PLAB 1, PLAB 2, then you're officially good to go and you can get yourself registered with GMC. All right, then you get your GMC registration. But in case you fail PLAB 1, so you can always retake the exam. It's recommended to review and improve your preparation before reattempting. So you can always retake the exam, but it's important that when you're going to retake it the next time, you work hard, you know what skills you were lacking, what particular areas you did not have the right knowledge of, or what sort of preparation you require, and then you can basically um, you can retake the exam. Okay. Now, the big question is PLAB 1 hard? Because that's a very famous question that everybody asks this question at the end of the webinars or at the end of the sessions that, is this doable? Is it hard? Is it easy? What would you grade it? The difficulty level, etc. So, it's not that hard. If I compare it with any other exam, let's say with FCPS in Pakistan, or if I compare it with USMLE, so it's comparatively easier. You don't need extensive studying to get through this exam. It's just you need to understand the tips and tricks and smart study approach. If you work on that, then this exam is very much doable. It's not difficult at all. All right. Uh, I'll come to it. There are a few questions in between. I'm just looking at the chat box. Okay, I can take the questions in the end. What do you all say? I'll go through the chat box in the end and I'll take the questions
Yeah,
because
yeah,
let's
yeah.
just get
Questions,
over with
questions at the
the
end, actually.
yeah.
Yeah,
Yeah,
questions
because
at the
in the
end.
end I have the time for question and answers. Right now, let's just get through the presentation. So it's a very much doable exam. It's just that they're testing whether you have the knowledge. Everybody has gone through the same subjects, the same exams in their med schools, right? It's just everybody has a different retention criteria, different recollection of knowledge. So what they're assessing is whether you can recollect that knowledge. Okay, it's right there at the back of your in the back of your brains. You have that knowledge. You just need to revive that knowledge and implement it where it's required. That's it. That's the exam. That's what the exam is all about. They're not triggering your basic sciences too much, but they want to know that you should have a good understanding of the basics and how you're basically implementing that knowledge. Is there any question? Somebody raise a hand. If there's a question, you can ask me. Otherwise, we'll take the questions in the end. Okay. Then, another important thing, like I said, in between, in the middle of this webinar as well, one thing that I was working. Okay, the question is how many marks are we supposed to score in PLAB 1 to pass? So like I said, there is no threshold or there is no particular number. It's a pass-fail exam basically. So on the exam day, how many ever, it depends. They have their own list of right or wrong questions. So I don't know what's the right word to call it, but it's something like the more a question, the more number of people are going to correct a question, the more marks it'll have, or the less marks but you'll have, something of that sort. And if there's be a difficult question and few people score it well, then you get more marks for it. So it's not like that every question carries equal number of equal number of marks. It's like they have their own distribution based on difficulty level. They have distributed the questions within the exam. So people who score well in all who in one question, if they're scoring well, then obviously that particular question has a less number or less marks as compared to the other one. So it's something of that sort. And you can obviously the detailed examination and assessment etc is not discussed anywhere, but this is how it is. And there's no set number of marks or scores or questions that you need to get right in order to pass or fail this exam, right? So the 300 to minimum is obviously you need to score at least half of them right to get through this exam. All right. So if there's 300, every 300 marks, so at least somewhere around 120 plus is a good score, is considered good. All right. All right. So next what were we talking about? Yeah, we were talking about that the answers from the answer. Like I said, it's basically the testing your recollection of knowledge, whether you are able to pick up the diagnosis, the correct diagnosis, and then whether you're managing and assessing also and investigating in the right manner or not, right? Second important thing when you're working or when you're studying is you need to understand that you have to implement this knowledge in a UK based practice or in environment or in a healthcare setting that's based in the UK, not in your own setting. More or less, the medicine practice is same all over the world, right? But then there are a few other things that are very common in your particular region as compared to the other region. For instance, TB is very common in our region, but it might not be a very big issue in the UK. All right. So that is why their problems are different as compared to us. Alcoholism might not be conditions or related to that might not be very common in our setting, but they're extremely common over there. And how to deal such a patient who comes to you with this, or how you're going to counsel, how you're going to assess, what you're going to investigate. So such questions are very common. So when you're preparing, make sure you're preparing in a way, or you're answering the questions in a way that are based on the UK based practice, right? Then like I said, you're working in different places where different policies, different protocols, etc. are there. But when you're working in the UK, you have to work on their guidelines. So the NICE guidelines are very important, right? NICE guidelines are extremely important for any topic that you're studying. NICE guidelines, you have to look up the guidelines, the latest guidelines of how to diagnose, manage, or treat a person of that particular condition. And obviously in Plavable as well, and all the other subscriptions, when they're answering or when they're giving you the explanation to your questions, then obviously they do mention which resources they use and which guidelines they have. They share the link, so you just click on that link and that particular guideline pops up. So you go to the guideline and you get a better idea. So the guidelines are very important when you're working, when you're studying for PLAB exam. It's not just that you have to do MCQs and just PLABable material. You have to also read up the guidelines. You have to also work and retain information that are based on UK's practice. Now, two major areas are usually tested in your exam. All right. One is the acute presentation And secondly, are the long-term or chronic presentation. There are two presentations in medicine. One is an acute sudden emergency presentation, right? Where a person comes to you with trauma in the ED, with problems, etc. So that's an acute presentation. So most of your questions can also be based on acute presentation, where they're asking you what is the diagnosis, what's the best investigation you'll offer, what's the how would you manage, what's the first line drug that you give, what's a life-saving drug you give for this patient, etc., etc. So one presentation is the acute presentation. The second is basically your long-term or chronic conditions, and they're the ones that are basically referred, or they come to the GPs, the GP type of questions, which are very general. Okay, family physician GP questions. So second, your assessment is of those areas, right? Geriatrics and people with chronic conditions, chronic tumors, chronic hypertension cases, or myocardial infarction, or CHD cases. So all of them would be in this category. Okay. Then, like I said, you'll be tested for diagnosis, for investigations, for management part, right? And you can also, there'll be questions um, about a particular sample. For instance, they give you an ABG is given, and they ask you what is this based on your how you interpret the results. Similarly, they give you a blood report, and they ask you that what is basically your diagnosis, how would you manage this patient. They give you a picture of an X-ray, or maybe an ECG is there, right? And then they ask you what the diagnosis is and how you would manage. So such questions are very common. So how can you score well? By starting early. It's important that you start in advance and give due time. 3 months is ample time, is the most best, or you can say the standard time that you should give to the PLAB exam. People giving a month or going beyond 3 months, I feel like that's either too less or too much, but it's not sufficient. Because there's no point in extending your preparation beyond 3 months, because this exam can be easily done within 3 months. Okay, the preparation can be done, and giving it less than 3 months is also not justified in my opinion, because obviously month is not good enough to get through this exam unless you've a recent graduate and you have retained, you're very smart and you're able to retain each and every information, right? So this is important. So make sure you start early, you develop your own study schedule, etc. Right? Practice your questions. Set a goal that I have to practice this much questions from Blabbable, and I have to finish a module in 1 or 2 days, right? And then try solving all of those questions within the given designated time. All right, study groups, join study group. That's very important, right? Because study groups are such a blessing. They let you know about when GMC is going to launch the new dates. It tells you about what questions are, what were the questions in the previous years. A lot of people share their experiences. So study groups are very important, right? And take care of your health. Eat healthy, sleep well, and relax, and you'll easily get through this exam. All right. Time management is again a very important issue, and like I said, there are 180 questions, is 3 hours. So give 45 seconds only to every answer. All right, don't go beyond that. If you're spending too much time on one question, then make sure you compensate for the in the next question. You try to, compensate for that extra time, and then you just move on in the right speed, and you finish everything within the desired time, right? And before your exam, just try to remain calm. You've done the most important thing, and revise as much as you can, and just be confident in yourself and just get through this exam. It's very much doable. A lot of people have done it in the past and they're still doing it. So it's not a difficult exam. It's a doable exam with a little bit of smart study. All right. And so it's very important to conclude. In conclusion, I would just like to say that's very important. You need to understand the take-home messages that first of all, you all need to know what this exam is. Secondly, you don't have to panic with PLAB and UKMLE thing going on. Both are the same thing, is just the names have been revamped and rechanged, right? Third important thing that you all need to know is that when you're booking, okay, make sure all your eligibility criteria is basically right. Secondly, all the prerequisites required, like getting a score in IELTS or OET, those things are basically that checklist is also done. Then you sit for you book the exam. Once you've booked the exam, you make a plan, and you make a very detailed plan in which basically comprises of not just looking at the books, rather practicing as many questions papers as can. All right. So with good planning, constructive preparation, and positive mindset, everything can be done significantly to boost confidence and to help the students, right? So thank you, everyone. And anything you guys want to ask? Anything?
Thank you very much, Dr. Iffat. So the question that I have is about, let's say, you talked about the computer-based. So since
Yeah.
when actually the PLAB has changed from paper-based to computer-based? And also, can you just please rewind the slides? Actually, there was another slide, not the conclusion, the slide before conclusion. Before this. Yeah, this one. Thank you. My question was actually that when it changed from paper-based actually to computer-based.
Sorry, what's your question is? Can you repeat your question?
I actually asked that before it was paper-based, right? The test.
Yeah, previously it was
This was
paper-based, but now it's
paper-based.
computer-based. You just have to choose the answer. You don't have to shade it. Okay, most of the centers are offering computer-based. It's officially become computer-based now. So I've just written this shading the answer thing, but you just have to, choose the right answer. It's a computer-based test, all right? So give 45 seconds to every question almost. Clear?
Will there be a paper actually, extra paper actually to do some calculations, some mathematics
Yeah.
and these
The
things?
rough sheet is provided to you. A 2B pencil and a rough sheet is there with you because obviously you have to make notes, you have to write. Some people they find it easier to write things down and then decide. So the rough sheets are provided to you. A 2B pencil is given to you by the exam center. The test is just computer based. You have to select the right answer on the computer. All right.
Thank you so much.
Okay, no problem. Okay, one more thing I wanted to share was that this is just a detailed plan I developed with the help of a few people. And this is something that you can also, if you want to take help from it, you can do that. It's just a plan that, in 3 months, what's the ideal way to cover all the course and how you can basically divide your preparation over the course of 3 months, right? Obviously, it is subjected to change. Everybody has their own way. Some people are good at certain modules, so they give less time to that particular area. It's all up to you. And the best plan is obviously developed by every individual themselves after knowing are their, what are their strong aspects and what are their weaker aspects. So this is something that you can look into and you can develop your own, obviously, plan, right? So in this way, you have to cover everything from derma to psychiatry to genetics, neurology, endocrinology, women health, MSK. We have statistics. Okay, one thing is that the part where they talk about the study designs, if you recall, the in your medical school as well, there was this subject where you study research and how to infer biostats. So that's important as well. So a few questions do come from that chunk as well. So biostatistics is important. Make sure you also cover that thing, right? It just cover all the modules, but obviously you can divide your number of questions that you're doing to a limited number from those modules, but cover everything up.
Ma'am, can you go one slide back, ma'am?
This one,
No, ma'am. Before that.
I'll show it from the beginning. Wait, you can all take pictures if you want. Starts from here, day 1. Then we have day 11, 11 to 20. Then we have day 21 to 31. Then we have day 32 to 42. Then we have day 43 to 53. Then we have day 54 to 63. Day 74 to 83. And lastly, day 84 to 90.
Ma'am, I've heard that just passing PLAB 1 and PLAB 2 is not enough to land a clinical training job in UK, ma'am. And we need other things on our CV like a research paper and QAP and auditing, ma'am. I'm not familiar with all those, ma'am. I am currently working on a research paper. I'm currently working as a junior resident, ma'am. What other things should I need to do to add to my CV so that it can help me and others as well to land a clinical training job in UK, ma'am?
Yes, so things are basically not so easy now in the UK. There was a time when people would just tear their PLAB 1, PLAB 2, get registered with GMC, and there were lots of jobs available. But things are changing. There's lots of saturation in the NHS, and you don't land a job so easily these days. So what's advisable is that, whichever country you're from, you have gained some sort of clinical experience in that, in any area, right? As a junior doctor, you gain clinical experience, any relevant experience, because that will count in your CV, number one. If there is a medical college over there, so a teaching experience makes a lot of difference. Okay, it changes the entire thing. So a teaching experience, like work as a lecturer somewhere, give freelancing, online sessions, anything. Freelance experience also counts, by the way. So anything that you can go where you're teaching your peers, your juniors, something of that sort. Teaching experience does make a difference. It has a very important role in your CV. So make sure you check that point up as well. Third important thing is that research paper, research work. So it's okay if you have local journals. You can get your researches published over there. Start with the most basic research, which can be any cap study, knowledge study, where you can just, if you're working in a healthcare setting, in a hospital, you can take a very easy topic, do some literature search from Google Scholar, and pick up a very easy topic about anything, about a personality issue, ethical dilemmas among doctors, uh, brain drain among doctors, the junior doctors and their problems, concerns, any basic topic. If you're working in any other setting, whatever problem is prevalent over there, patient satisfaction, patient's problems, knowledge, any particular aspect, take any topic like, for instance, hypertension, and see whether how much knowledge does a layman have regarding it. So any basic study, you can also do it on your own and get it published in a local journal, right? Publishing a research is not difficult at all. But it's a little bit draining because you have to write the entire thing up and you have to go through that entire process of data collection and everything. So that takes a lot of time. So fourth important easy thing that you can do is, if you're working in a hospital, is clinical audits. Audits are very easy. Like every hospital would have somebody doing an audit over there, right? Audit is like anything that they're doing. They just basically you know and they judge whatever the outcome is, and they compare it to something, and they basically review their own experience or their own clinical skills, and for the next time they improve it and develop an audit, and they change the policies and change their stuff and their method and everything. So audits are also very simple, and audits are very much doable, because in that case you don't need to publish it, you don't need to go through that entire procedure of writing, etc. You can easily do a audit and you can write it down in your CV. So audits are again very common. Fifth thing is that, in case you were very good at giving exams and you want to make your CV much, much strong, and you want it to have a lot of things in it. So the MRC pathway, the Royal College exams, the membership exams, right? Having even doing like the first part of Royal College exams, any membership exam, like let's say MRCP. If you want to go for surgery, then MRCS. If you want to go for GP training, then MRCGP. If you've qualified those Royal College exams, then obviously you land up in a training post, and that significantly strengthens your CV. So these things are important, right? Other than that, clinical attachments these days are also making a difference, and obviously for those clinical attachments, you have to go to UK. So if you know anybody, because obviously things are changing now, okay, and you need resources, and you need some sort of in easier ways, you can say that you need some sort of references, right? A lot of people don't have references in the UK. Everybody doesn't have a family member there, or they don't have people, so juniors or seniors working in hospitals there, right? So what you can do is, if you have somebody, use that resource, use that reference. If you don't have it, just go to the UK when you go for your PLAB 2, and you get yourself attached to a clinic or a hospital and get a clinical attachment. Build your CV through that. Get used to the NHS system. Just how the people who take the USMLE pathway do, you do the same in the UK. That you go there, you spend some time, you do ACLS, BLS. This is another thing that will strengthen your CV. A lot of people are doing it. If your home country, somewhere in the home country is often, that's fine. But doing it from the UK would make your portfolio more strong. So once you go for PLAB 2, you also do your ACLS from there. All right, you clear it up, so that thing also is important, and you get an attachment, and you build your resources over there, references over there. Any doctor you're working with, build a good repo, so that that doctor can help you in getting a job, in securing a job over there. So these are a few things that you have to work on over the pathway, because now things are not so easy. So you have to work on a lot of things in a lot of aspects in order to get a job in the UK, right?
Can you please go to slide 64? I mean, just the question 64. I mean, just page which starts with question 64.
Which question? 64?
Yeah, 60 after 63. The other slide 64 should come, right? It's the 63, the last question. Where's 64?
It's 74, 62, 63. All right. I'll share it with you all. I think I missed that one.
Yeah, I
Yeah.
couldn't find it actually. So can you please share it now?
I'll share it with you in the WhatsApp group. I'll share it, and then you can all look at it. My bad. I just missed that part. Right. So I'll share that thing with you.
Ma'am, can clinical attachment be done without writing PLAB in UK, ma'am?
Clinical attachment and without writing PLAB. Not sure about it, but what I know is, and what I've seen people doing is that it's usually people sit for it after they've got the PLAB too, because without it, you don't have a proof of, having some sort of knowledge of working in the UK. You can get an elective. Okay, elective is something different. It's like or an observership. That you can do it. People in undergrad years also go for observerships and electives. That's some different thing where you're being shadowed. Attachment is also more or less the same thing, but it's like it's with your exams, it's easier to get yourself, or to show yourself that you've cleared this exam, your intent is this, and you have to basically get this attachment. So there's a different approach in that. But yes, obviously, people in undergrad years also go, and they don't sit for the exam, so they do get observerships and clerk and electives. So you can go without the exam as well, I think.
So, Dr. Iffat, regarding, let's say, the publications, mostly you mean peer-reviewed journals, right? I mean, just peer-reviewed journals which people gather, actually, they write a systematic review. It's a form of a structured literature review. They're just assessing a question, actually. They're just going to synthesize data collection, use the methodology, actually, quantitative or qualitative. So it's mostly the peer-reviewed journals, actually, which gives us point, actually, into entering the foundation program, let's say, or the Royal College of Physicians, or I mean, just a specialty program.
Can you repeat your question? Sorry.
My question was actually regarding the publications on the medical journals. If you are just, for example, having a review, definitely a systematic review, assessing a question, actually, the effectiveness of intervention or something. So how many points is going to give us, and which kind of publications are accepted to have an H, to have a plus for our applications to be accepted for work, let's say for residency and beyond?
Okay, so now there's no such, if you say that, there is this particular misconception that, you have to have lots of research articles to land a job. It's just that all those things add on to your CV. It's not like that if you've done a systematic review, that will have less points as compared to a cohort study you're doing, or a case control study, or, it's not like a cross-sectional study. Doing a research is the thing that makes the difference, whether it's a systematic review or it's a It's a cross-sectional study. So those things don't have points. It's just on your CV, those things make a difference. That okay, if there'll be somebody who doesn't have it and you have it on your CV, then obviously you'll get some added benefit. Plus, medical journals, obviously local journals are also accepted. It'll be great if you have some international publications in some international journals. Obviously that'll make a difference. And thirdly, like I said, audits also have a lot of significant role. So all those things are just like, added things. They just are the cherry on the top. If you have them on your CV, you have a good good chance of landing a job. But like I said, it doesn't guarantee. Things are getting different now. It doesn't guarantee. References are something that are also making a difference these days. There are people who don't have anything on the CV, and just because they have a reference in any hospital, or they've gone through an observership or attachment over there, they do get a job. So it's not like this that it's also pure luck, I'd say. You can't guarantee something unless fate is with you. So you have to have some sort of luck needs to be there as well in order for you to land a job. Plus, a lot of people, what they do is they look for training posts. There are also certain clinical posts and training posts, but non-clinical jobs are also very common, like teaching jobs. So in case somebody doesn't get the clinical job, you can always apply for a non-clinical job and just get a job and then reapply. And once you land a job over there, you can obviously switch and reapply as much as you can to get a better job. But non-clinical jobs are also very common, and they don't have they don't need a lot of stuff as compared to a clinical post. And then obviously that also makes a difference, the trust you're applying to, the jobs that most of the people, they target London and central London and places around it in England. But Scotland, that has over there are lots of opportunities. Obviously the pace role is a little bit less as compared to UK, but they do have a lot of jobs over there. So all those things have a role, right? Hope that answers your question.
Yes, definitely. Thank you very much.
No problem. Yes. So any other question?
Islamic ma'am, I have a question
Yeah.
regarding
Yeah.
MRCGP. You mentioned regarding the MRCGP. Were you referring to MRCP or were you referring to MRCP UK based? Because that cannot be given unless you have a training in UK, and we're sitting in Pakistan. So how could we attempt the UK one in order to make our CV stronger for
UK?
MRCGP, ma'am.
MRCGP, okay.
Yes.
MRCGP has a different protocol, obviously. MRCP and MRCS, these are the two exams that you can give without, even after your house job, you can sit for these exams. But obviously, if you're working as an MO or also as a resident in medicine or surgery, then things get easier for you and you can sit for these exams with the clinical experience. But for MRCGP, there are two MRCGPs. One is MRCGP International, and one is International South Asia, and one is MRCGP UK. MRCGP UK is accepted worldwide. For that, they have a different eligibility criteria. For that, you need 5 years or more experience, and there are lots of other details regarding it. MRCP International South Asia is now being also accepted in Australia. That one has a less criteria, less eligibility criteria, so you can sit for that exam. But obviously for MRCGP, things are different, and you cannot give an MRCGP in order to go through the PLAB pathway, right? MRCP, MRCS are two different other things, but MRCGP has a different eligibility criteria and everything. So you cannot give it right now in order to get a job in the intention of PLAB, right? So MRCGP has a different thing, and MRCGP needs some sort of working in the UK environment, some locum, some training from the UK. Then you can sit for the MRCGP exam. But MRCGP International South Asia, you can give it, which is also being accepted in Australia.
No, ma'am. Suppose I have GP International. I'm making my CV stronger to make the process for potential job in UK after passing my PLAB 2. GP International would do any benefit to my CV or not?
Okay, so now it depends upon what you're basically doing currently. Where are you working, and what is your, till now, what's in your CV? If you can elaborate on that.
Working with resident. No, I'm working in a medical hospital. I'm working as a resident.
Okay, you're working as a resident in what department?
Medicine.
In medicine. So for you, MRCP is a good pathway, not MRCGP.
Yes.
MRCP would help you in landing a job because getting a membership from the Royal College in Medicine and working as a resident in your own country as well in medicine. So when you sit for the PLAB 1, PLAB 2 exam, and if you've also passed your MRCP and you have the clinical experience as well, you will automatically land at a training post over there. So there would be a difference. It would have definitely have a better impact on your CV. You can always try having your CV without an MRCP and apply for jobs. But in case this MRCP pathway works, in case you don't get a job, once you're done with your PLAB 1, PLAB 2, you get registered with GMC, you start applying for jobs, you get interviews. In case you don't get an interview, in case in the first cycle you're not, you don't get a call, you don't get any interview, you don't get a job, right? Then in order to strengthen your CV, you can go for the MRC pathway. It's not like that before applying for the jobs, you sit for the MRCP, and that's the second option. That in case you don't get it, in case you don't get selected, you don't get a job, then obviously you can do the MRCP in order to strengthen your CV. All right.
Yes, ma'am. Thank you so much, ma'am. Thank you so much, ma'am. Thank you.
No problem. Okay, there are a few other questions as well in the chat box. Let me answer that. So Med Revisions or Plabable, both of them are good resources. I'd say if you have a lot of time, Med Revisions is very good because the notes are well explained, they're in detail, and they're also understandable. In Plabable, the explanations are quite short, and they just send you the link. There's a link attached for the guidelines. But in Med Revisions, everything is very well elaborated. So if you have a lot of time, like 6 months, 5 months, go for Med Revisions and then do Plabable as well. But if you are short of time, only you have 3 months, then Plabable is a resource that you should opt for, right? And obviously, the preparation also depends upon how much years have passed since you've graduated. A fresh graduate would have a different knowledge as compared to somebody who graduated years back. So depending upon your year of graduation, your application of knowledge, whether you're working right now or you have a gap in your CV, you're not working, you're a housewife, you're a stay-at-home parent, then in that case, you have to give good time to your preparation, right? 3 months will be too less for you. So you have to extend your preparation to at least 6 months. Do a detailed review of all the topics. Get over all the main topics. Open books for it. Open explanations. Use med revisions, and then you can basically you'll have a better knowledge, and then your knowledge would be obviously the knowledge will get updated, and then you can obviously do Plabable and do as many questions you can to improve your preparation, right? So depending upon what your current situation is, your preparation would vary. It won't be same for everyone. Okay, if I shared the 3-month thing, that doesn't mean that everybody can do that in 3 months. Some people take more time, some people take less time, some people have a more gap as compared to the others. Some people are clinically practicing, they're clinicians, some are not. So it depends upon your current situation, right? Then I've answered the job situation question. So it's tough, but it's doable. Then we have defined syllabus. So there's a blueprint on the GMC's official website. I'll share the link with you all as well. The blueprint over there tells you how much, like it's like a toss, table of specification. It tells you that from every topic, how many questions would be coming, what would be their weightage, and every module, etc., is basically shared on that blueprint. So blueprint is from the official website, so it means it's an official thing, and you have to go through that blueprint so that you know that how much time you have to give to each question, right? And the next question is lots of people with GMC registration but no jobs. One thing that you can do is what a lot of people are doing is that with GMC registration, I think you can work in Australia, you can work in the Middle East. So people are going to that side as well. In case you don't get a job in UK, you can obviously look at the other aspects, all the other countries that are accepting GMC registration. So you can work over there. And secondly, you can do the MRCP pathways or membership exams to qualify for a training post in the UK. Right? Clinical attachments can be done without PLAB in the UK. Yes, you can do an observership or elective, but obviously attachments, I think you need to get your PLAB done. You need to be GMC registered for it. Then teaching jobs. So teaching jobs are there. They're non-clinical jobs, and like, working as a research associate assistant in a university hospital, or but for teaching experience, it's important that in your home country as well, you have some sort of teaching experience plus a diploma or a master's in medical education. Okay, that's a very it thing these days. So something of that sort on your CV also makes a difference. And it's for everyone that if you have something related to medical education on your CV, that also makes a very important, significant difference. So make sure anything you take up, those these days on Coursera and other websites, they're offering many, medical education related stuff and seminars and webinars. So make sure you go through those things as well, and you have certain, credit hours on your CV and all those things. The more things that are on the CV, the more it'll be better for you. And yeah. And then somebody who has a big career gap, it's completely fine. I said career gaps are not a big deal at all. There is one thing that is important in case of a career gap. You need to justify your career gap, okay? Because having a career gap is not a wrong thing at all. Okay, a lot of people take that as a taboo, and they think that now we have a career gap, so we will not land a job in the UK and we'll be jobless. There's no point in sitting for this exam. That's a complete myth. There are people with very big gaps, and they're doing so well in life, and they have gone through this exam. They've gotten such nice jobs and posts, etc. So having a career gap is not a big problem, but justifying that is important, right? If you've taken a gap because of your kids, then you justify it with that. Okay, you were a homemaker in that time, you were giving time to your kids, you justify that point. If you took a gap because of any other reason, then you justify that gap. Okay, and if you've taken a gap, then you need to, in any online course, there's lots of, these days online education portals and stuff that are available. Many family medicine diplomas and medical education diplomas are there. So you can always put that up in your CV, or get some sort of short clinical experiences from nearby hospitals or clinics, or from doctors, to fill those gaps. And in case you are unable to do that, just justify your gap, all right, with evidence. Okay, in computer-based exam, yes, you can go back to the questions, right? And MRCGP International South Asia is not accepted in the UK. There are two MRCGP, like I said, one is MRCGP UK and one is MRCGP International South Asia, right? That is accepted in Middle East and now in Australia as well, but it's not accepted in the UK. Right? So if you've cleared that, you cannot get a GP post in the UK. But if you've cleared the MRCGP UK, which you obviously can clear after working in the UK in the NHS, that is acceptable, and that's acceptable worldwide. The next question. If someone has MRCGP International South Asia, either he can do job in UK or he has to give another exam regarding equivalence. So you have to give MRCGP UK in order to work in the UK. All right?
I think, Dr. Iffat, that there is something with Ireland, let's say the Irish, that people from South Asia actually, because they've got a shared council somehow, that they can come and work. And I've heard about this one maybe just 5 years ago, but I'm not sure that if it has changed or not. And also one more question, doctors, can you just, for example, looking at the screen, for example, day 74, can you explain it? It means that 70 days to go, definitely, statistics 4. And on this day, we should do, let's say, the screening table and calculations only, so the topic is going to be there. And we should do at the same time the question banks. Can you just, for example, explain one typical day according to the days actually? In a single day, what should we do?
Okay. So I'll explain you that. Yeah, I think you were talking about the Irish Medical Council, so they have a different, their dynamics are completely different. They also just they don't take any sort of, I don't know about now, but till last year they were taking a simple MBBS degree was also okay over there. and they didn't need any sort of licensing exams or membership exams, etc., on the CV to basically work in the island. So island works in a different way, right? And the last question before, and then and let me just go through the last question, then I'll answer your question about how we going to work on every day. So the last question was that what's the tips for clinical gap people in preparing for PLAB and also getting a job? What we advise about James 6 7. Yeah, so I think the 1 year hospital experience is required. Obviously, in Australia, Australia has its own exams, and they're also accepting PLAB. But yes, and I've heard New Zealand also is also accepting PLAB. But you have to have some sort of experience of working in that environment as well. So that thing makes a difference. And for clinical tips, I explained for the clinical gap people that you have to put in your CV. You can register for the online courses that are available. You can work on clinics, work in the clinics for in order to fill that gap. You can gain some sort of experience, teaching experience, any freelance experience. You can use all those things to fill in your clinical gaps. Otherwise, just justify why you took a gap. All right. Now, if I explain you the table, so it's like on every day, if you have got 3 months, so obviously it's not possible um for you to go to the course, right? So we have Plabable for that reason. Okay, if I talk about my preparation, how I went for this exam was that I subscribed to Plabable, right? And what I used to do is that suppose if I'm doing my cardiology on day one, the most first I would distinguish depending upon the PLAB blueprint. I would look at what is the weightage of every particular module or every particular topic, right? Once I've decided what the weightage is and everything, then I would judge how much I know about a particular topic. Like if I feel like my cardiology, my ECGs, my MIs and hypertension things are not very good, and I feel like my geriatrics portion, endocrinology, I'm really good at it, so I would divide the time and I would give time based on what my approach about or what my knowledge about a particular subject is, right? Then once I've done it, the difficult things, I would give time to it initially so that I read them in depth when I'm preparing. Like for instance, if I'm talking about cardiology on day one, so I would go over all the the heart diseases, the hypertension part, the congenital part, and then the ECG part. I would give due time to it before looking at Plavable. I would go through the course material. I would go through the my Oxford handbook or any other resource, or maybe online, use the help of Google, etc., and just understand the core concepts that I have to revise in order to get back to it. Once I've done that, then I would open Plavable and I would start doing the questions for the particular topic, right? I would do the questions related to cardiology on my day one and day two because cardiology requires lots of time. So I would do that. And while I'm doing that, I'm going to look at the explanations. Then the guidelines that will be shared, I would also click on those the guidelines and I would go with the nice guidelines. I would make notes for it. I would, give due time to it. So depending upon what my knowledge or what my experience is regarding a particular topic, I would give time like this, right? But for topics like, suppose I feel like my endocrinology is good, I don't need to give too much time to ethics or medical legal cases. Maybe I can just really quickly go over the allergy part, the anaphylaxis part, for instance, or ENT and I feel like my ENT are good. So what for these less important subjects, the ones that don't need much of a review, I would just go to Plabable and I would start doing their questions, right? Like what we'll be practicing in our sessions. We'll just go over the questions and we'll discuss the explanation that why is this answer correct and why the other is not correct, right? And then we will keep the guidelines in mind and then make notes about how we have to choose this as an answer and not this as an answer, how this particular question is different, how this scenario is different, what the management of this condition is like, what the management of the other conditions. And simultaneously, I would make notes of all of those things so that before the exam day, I have a good amount of notes available with me, and I just go over it before the exam day, and my concepts are revised, reviewed, and I have enough knowledge to sit for the exam. Do you get an idea about what I'm saying? This
Yeah.
schedule was just to let you know about the important topics and about how within 90 days you can prepare, right? But at the end of the day, it all depends upon your knowledge retention. Like I said, some people are quick learners, some are not, some have a less gap, some are really fresh graduates. So all of that depends upon your personal things and how you're taking it. But But going through every topics, opening a book for every topic is not advisable, right? So keep this in mind. But yes, doing plabbable questions, your going through the question bank, going through the explanations is important. You go through the question bank first, and then if you're having a hard time understanding something, or if you think you need to review a concept, then you open a book. That's the strategy. It's not the other way around. Back in med school, we used to open a book and then go to the question bank, but in post-grad exams, you open the question bank and then go to the books. You get it? This is the thing that you have to keep in mind. Clear?
Yeah, it's clear actually. Now I have a good understanding, let's say, on what to do in a single day, in a single typical day actually. So to go through the explanations, to go through, to read it from one different sources actually, to check the plappable questions, to read them and to make notes, read them, do revisions actually.
Yeah. And now I will, somebody was asking about the blueprint, so I'll help you. I'll share the blueprint right now. I also share the official website with all of you so that you can look at it on your own as well. Right, and in our sessions, I'll just give you a brief overview about what we'll do in our sessions. So in our sessions, obviously, we're going to work on your questions. We'll use the other strategy that I mentioned. We'll discuss the questions, and then in order to review a core concept or in order to refresh something, we'll talk about that thing in detail. But mostly, we're going to discuss questions and their answers, right? And we have also recorded sessions. Previously, we were taking lectures of every topic, but we found that that strategy is not very authentic, because when we're also doing studying on our own, we don't want in-depth lectures. That's something that's now obsolete when it comes to post-grad exam. Question banks are the newer things, and the question bank is the thing that helps you get an idea about what your exam would be like. So we will provide you with the recorded lectures just in case anybody wants to go and study in depth or review something. Then obviously you can visit those lectures. But in our live sessions, which will be around 2 hours long, we will practice as many questions as we can about whatever topic we're doing, right? The official website is gmc.uk./org. I'll share my screen to let you know. So this is your official website, gmc-uk orgs, right? And can you all see the screen? You can just write GMC on Google as well, and the first thing that will pop up would be your GMC's official website. Right then. You can all see it. Over here, you can also look for a summary, detailed explanation about what PLAB is, what a UKML is, PLAB on preparation resources, PLAB reports, pass rate, everything is written over here, right? And this is an explanation of how do they work on your score. So each correct answer is worth 1 mark, and the total number of correct answers will give you your score. And in your results, we will tell you your total score, the score required to pass the exam, and the average score for all candidates, right? So the score required to pass the exam would obviously change. It's not a standard, and that depends upon the average score of all the students on that who are sitting for that particular exam, right? The schedule, I hope you can see it on your screens. The tests, etc., the schedule, etc., is also over here, but all right, and then blueprint is also somewhere over here. You can Search over here. So in detail over here in this website, you can also look for the blueprint. Okay, it's not coming right now, but it's available over here. Right over here, somewhere over here. And they also have the blueprint. All right. So you can go to the GMC's website and look at all of these things in detail. All right, clear? Somebody's asking about medical education courses. So medical education courses are basically they're courses that are some universities they offer online as well in Pakistan as well as abroad. They have diplomas, they have health professional education diplomas and courses which vary. They're from team-based learning to problem-based learning to helping adults learners. The concepts and the themes are very different, but they have a good impact on your CV because they give an idea that you've been you're attached to something relevant to teaching, and that helps you in working in the USA in the UK as well. And plus, for non-clinical posts, they also make a difference. So medical education course you can look up on Google, and there'll be many websites, many paid courses are also there from very good universities. If you're targeting UK's university, if you have good if you have good savings, if you want to spend money. So there are also lots of medical education courses in very famous universities outside. So you can always opt for them as well, just to fill in your CV. All right. They have different cons, like medical education. If you ask me what it is, so it's basically, how it's something about how you teach or at undergrad or postgrad level, and how you can inculcate teaching practices, good doctors, how you can make a good doctor, lifelong learner, things of that sort. All right. About introducing AI methods. AI is also very new thing. So some things, AI in healthcare, introducing AI concepts in medical education. So these things also are important, all right? So anything else you guys want to ask? And this was all from today's webinar. I hope you all found it useful. And if you have any queries about joining the course, if you were looking forward to join the course, it's going to be spent over, we're going to extend it over the next 3 months. We'll, like I explained to you, we'll provide you with recorded lectures, and in the live sessions, we're going to practice MCQs, the questions, right, from question banks. And we'll explain you in elaborate answers and let you know how you have to basically correlate the stuff. And it's going to be a 3-month course, obviously. So yeah, that's it from my end. Thank you all. Any other question before I conclude the session? No? All right. So please do leave in your reviews. We'll be looking forward to having you in our sessions. Take care, everybody. All the best. Goodbye.